Welcome back. The Royal St. Lucia Police Force has categorically denied claims of an officer at the Ancillary Police Station testing positive for COVID-19. A voice note has been in circulation alleging that the inspector at the station may have tested positive for the virus and therefore the station was not operational. Press Relations Officer Corporal Ann Joseph explained that the station was indeed temporarily closed, but that was out of an abundance of caution due to an inmate housed at the station falling ill. Jacques Wooding has more.
The Royal St. Lucia Police Force has rubbished allegations that some members of the force, as well as a prisoner from the Ancillary Police Station, have tested positive for COVID-19, which led to the closure of the station. These rumors come as a result of a voice note that has been circulating on social media. Press Relations Officer of the RSLPF, Ann Joseph, explained that in compliance with said protocol and out of caution, the station was temporarily closed. However, no one at the Ancillary Canaries Police Station has tested positive for the virus.
On the 23rd of October 2020, a male prisoner was taken into custody at the Ancillary Police Station. During his time at the said police station, he took ill. Out of an abundance of caution, he was escorted to one of our respiratory clinics where a COVID-19 test was conducted. Since then, his results have been relayed to us and he is COVID-19 negative. Other tests were conducted on the prisoner and he has received a clean bill of health. Following the discovery that the prisoner was ill, all the officers attached to the Ancillary Police Station who were on duty at the time or had cause to have interacted with these officers or the prisoner were taken either into quarantine or isolation depending on their individual circumstances.
She, however, noted that some officers who had close contacts with the prisoner have still been requested to remain in isolation as there are sometimes inaccuracies with the COVID-19 tests. She noted that while the police station building was temporarily closed, officers were still on hand to attend to any needs of the public.
Sanitization works were conducted. So the station had to be temporarily closed. Operations from the police stations, not the operation of the police in that district. We still had persons responding to reports, however, not from the station while the sanitization works were being conducted. As a result of the voice note that we have heard making the rounds on social media, we'd like to clarify that situation and let the public know that we have protocols in place that have worked. We were one of the first organizations to have been impacted by a positive COVID-19 result. But it showed that if you adhere to the protocols, we can mitigate the spread of the virus.
She noted that all protocols that have been established by the health officials are being adhered to by the Royal St. Lucia Police Force. Joseph explained that it is mandatory that if any officer, close contacts of an officer, or prisoner is suspected of having COVID-19, the station has to be locked down in order to be fully sanitized and isolation of contacts need to be done. Reporting for Hot 7 News, I am Janine Gonzalez.
Following the approval of an antiviral drug to treat COVID-19, the St. Lucia Medical and Dental Association has pledged support to government if considerations were to be made for procurement of the drug.
Absent of a vaccine, the medical community has been desperate for an effective treatment for COVID-19. In early October, the first treatment drug received full approval from the United States Food and Drug Administration. This has been welcome news by the St. Lucia Medical and Dental Association, with SLMDA President Dr. Merle Clark ushering support to any local initiatives to bring in this kind of drug for St. Lucia's COVID-19 response. However, Dr. Clark notes that the medical community remains abreast with continued trials of the new drug and reevaluation of its effectiveness in treating COVID-19.
There have been different drugs which have been, for lack of a better word, hyped at different points, but there's still so much we don't know about COVID-19 and no long-term trials have been done to show definitives with regards to which will be effective and in preventing or mitigating the symptoms of those so-called long haulers with COVID-19. We don't know that.
Dr. Clark says it is an unfortunate reality that small countries like St. Lucia may not have procurement efforts of these drugs prioritized by producers, particularly when global demand for COVID-19 treatment options is still very high.
We have to be realistic sometimes in terms of the limited supplies of the drugs. Who is going to get it? Everybody right now is competing on a world stage. And certainly, to be real, the more developed countries probably are going to be prioritized in terms of what they get. And if you were to get a supply, then you have to make a decision which patients are eligible for the drug, the criteria for when it's used.
The SLMDA president is relieved that to date, most of St. Lucia's COVID-19 cases have been mildly symptomatic, requiring only supportive medication, and leaving more time for authorities to build capacity for critical care. Jacques Wooding, Hot 7 News.
As the number of COVID cases continue to increase, many suggestions are being made in terms of how to curtail the spread of the virus. We took to the streets to hear from you what your recommendations are.
St. Lucia currently has 36 active COVID-19 cases in care and isolated. Majority of the cases being announced lately signal community spread. So we took to the streets to find out whether you believe it is time to re-implement the curfew or zoning of the country. Let's hear what you had to say.
You have to nip in the bud. Don't forget we are a small island, 238 square miles, 180,000 population. If that thing spreads rapidly, in about 2 weeks a month, the whole nation could be infected. So we have to do all what we can, stringent measures with a balance. I mean, don't go too draconian because people must survive, the economy must run. But for now, nip it in the bud. If we have to go back to the zoning, to at least put off all public activities, boat rides and so forth for the meantime, let us do that.
No, I don't think we should go back to the zoning and curfew. Why? Why? Because, well, given the cases, they had the zoning. Now, seriously, I'm not straying from your question, but let me tell you that, okay, as far as I'm concerned, I haven't heard of one corona death in St. Lucia, right? And I'm hearing that we have 4 deaths of dengue, okay? So when you tell me about quarantine and zoning, I more believe they should work harder to eradicate some of the issues with the dengue.
The way we are approaching that COVID thing right now, there every day is a case building up. I call in the Prime Minister to bring back the zone and the curfew, more the curfew. You see the curfew? For the fellas who are running out, I don't care, all I want, bring back the zone and the curfew.
Ça, moi, qui vous fait. Si l'école fermée, excessivement bagay la cassime, en gamme ni pour fait. Ma kay di fermer pays, parce que moi même pas conduire ma gouvernement. Mais c'est gouvernement qui ni pour ça privé. Mais moi Honda ça qui ka battre moi côté toutes ces corona ça a sorti. Ngata dans showroom base, ma ça privé, moi tan yo di hôtel ni, pas ici ni, pas là ni, moi même pas ça. Mais moi ka ouais c'est programme fait parce que ici pas ni l'hôpital pour mettre tous ces monde malades là.
Yes, I agree they can go back to how they had things in the beginning, and all they have to do is to monitor the situation properly, and then let us hope that the public follow the protocol, and they should be able to have things under control.
Even if they put a curfew back, that will not solve any problem for St. Lucia, because when you really look at the other countries, they have curfew and yet the people still getting coronavirus cases. So it's left to the people now to decide if they want to have corona or if they do not want to have corona. Because that some of the people, their head is so hard, they don't listen, they don't pay attention to what's going on. So everything is like a joke for them. Unless they don't realize or see a death for them to take things serious, they will not take anything serious.
If we have a lockdown, which means that the revenue that we're supposed to collect, because more you close down, is more revenue coming lower, you cannot, things will not be able to come into St. Lucia like before when we had the curfew.
I feel that the government should bring back the zoning and the curfew. I feel the curfew should be from midnight to 5 in the morning, because remember we have some of the hotels open. So it could be from midnight to 5 in the morning. And the zoning should come back.
And those were your responses. Reporting for Hot 7 News, I am Genevieve Gonzague.
Thank you, Genevieve. The government of St. Lucia and Lucelec have partnered to bring assistance and relief to people who benefit from public assistance and income support programs, the Child Disability Grant, and persons living with HIV/AIDS.
Qualifying households are set to start benefiting from a $75 bill credit under the Electricity Assistance Program, EAP, as the government of St. Lucia continues to implement the nation's economic and resilience plan. The Electricity Assistance Program seeks to provide temporary relief to specific households for 6 months, starting October 2020 to March 2021. The EAP will benefit recipients of the Public Assistance Program, the Child Disability Grant, persons living with HIV/AIDS, and approved beneficiaries of the Income Support Program for non-contributors to the National Insurance Corporation. On Wednesday, 14th October 2020, a memorandum of understanding was signed between the Government of St. Lucia and St. Lucia Electricity Services Limited, which will govern the implementation of this joint venture and welcome its start.
The signing of this MOU is an indication of our care for the vulnerable groups in our midst. Placing them on our priority list as a government and Ministry of Equity is no doubt in sync with our proclamations and promises made in the past. The Electricity Assistance Program, known as the EAP, is another indication that in this challenging period, where resources are proving to be at its lowest, the government of St. Lucia will not be moved to abort any of its humanitarians and/or outreach programs.
According to Minister for Equity, Social Justice, Local Government and Empowerment, Honorable Leonard Montoute, the COVID-19 pandemic brought on a health and economic crisis, but the government of St. Lucia remains committed to strengthening safety nets and safeguarding the vulnerable from these shocks.
I can also speak very definitively of the increasing range of needs being articulated to which urgent responses are required. Notwithstanding, I can assure you that amidst such troubling times, the government of St. Lucia remains committed to protecting the rights and dignity of its population and to strengthening social safety nets that safeguard the vulnerable and at-risk households in our communities.
Prime Minister of St. Lucia, Honorable Alan Chastanet, in his budget address on 23rd June 2020, announced a package of recovery and resilience strategies that form part of the national response to the COVID-19 pandemic. At the MOU signing, the Prime Minister gave an overview of the nation's response, including other economic incentives rolled out for citizens like the Employee Retention Program, income support programs, and tax waivers for landlords and small business owners.
In recognition of the need to provide that support to the most vulnerable groups and segments in our society, while managing the limited revenue of the state, it is imperative that any assistance offered should be targeted in such a way that there is value to those who receive it. Consequently, the Electricity Assistance Program was designed in such a way that it met both these criteria, adding economic value to most vulnerable groups in our society and making prudent use of our limited financial resources.
Protecting the poor, marginalized, and most vulnerable of the population is a commitment the government will uphold as it continues to roll out programs such as these. Reporting for the Office of the Prime Minister, I am Danielle Dubois.
Stay with us. There's more news after the break.